We are here with Dr. Bilski, and antibiotics, and sometimes people need to take these before the appointment. Is that correct? And if so, why the heck so?
Okay. So people have heart problems and joint replacements, right? Back in the day when I started right out of dental school, the basic protocol for anybody that had a joint replacement or mitral valve prolapse with regurgitation or without regurgitation, all right, that's all the stuff your physician handles, your surgeon handles, your MD or your DO. Dentists used to write the prescription for what's called a prophylactic medication. What that means is that preemptive, you take it before you come in so that whatever the dentist does in your mouth or cleaning doesn't disturb the bacteria that goes into your system, that goes to your joint or to your heart, all right? So over the 34 years that I've been practicing, the protocol's kind of changing in and out. So because of what I do and teach and write, I also have networking and people I know that are very well thought of. One in particular is Dr. Jim Rutkowski, and he's the editor-in-chief of the Journal of Oral Implantology. Well, he's a pharmacist, dentist, and a PhD in bone physiology for his support. So not only with that, he gets a lot of articles that he has to review, edit, ask for more information. And we call him Frankenstein. I think he knows everything, and it's kind of fun to talk to him because he does know medication. He's a pharmacist. He also knows how it works because he's a bone physiologist. He also knows how it works in dentistry. So he's a nice resource. So we just had a course that we provide in our biz. It's the Midwest Implant Institute, teaching dentists how to do implants and cosmetic dentistry. So we get Dr. Jim to come in, and he tells us about everything he knows, which would take years, but we spend a full day and he hits the bullet points of what you need to know. And the big one is, why do you take an antibiotic, or why should you take an antibiotic before a dental procedure if you have a heart condition or a heart valve condition or a knee replacement? And the bottom line is, based on the literature that he has reviewed, and he is an expert witness in medical malpractice cases, is that, let's use the knee replacement, very common. You have your knee replaced. Then you go away, you go through your rehab. The first 6 weeks, if you are without an episode, meaning infection, redo, something goofy happened, in theory, and in principle, and in reality, you don't need to take an antibiotic before you come in to see Dr. Bilski. All right? What happens is, now the American Dental Association, because they're recognizing this, is saying to dentists, hey, do not prescribe the penicillin or the Zithromax, the Z-Pak, for your patients prior to dental treatment, because you are not managing their health, their knee health. You're not. You don't know if they're with episode or without episode. As far as the heart's concerned, you as a dentist don't know if they have regurgitation or they do not have regurgitation. That goes back to the physician, the doctor that did the surgeries, or the cardiologist that's following them, the orthopedic that's doing the surgery on the knee. It has nothing to do with the dentist. So the big thing now that is talked about is, do we pre-medicate our patients before they come in to see us as dentists? If we do, and a mishap occurs with the knee or the heart, well, I'm practicing medicine. I don't have a medical license. Right. I have a dental license. Now we're in a problem. Now we're in a pickle. So the reality is, to make it really simple, when you come into our office and you have a knee replacement, I'm going to say, hey, do you have any problems in the first 6 weeks? Well, you've had your knee for 20 years. How do you know? You don't remember that. No, I don't think so. But if you did, and I called your physician to find out what happened, and they have in your records that, yeah, you did have an episode, then you probably need to have an antibiotic for the rest of your life when you come to see me. But if you were asymptomatic without episode in the first 6 weeks, before we say you can't have dental procedure for 6 months after the surgery, and you need to take an antibiotic for the rest of your life. Well, now we keep dumping antibiotics into our bodies. I mean, we're concerned about antibiotics in our food that we're ingesting.
Right.
But we're not concerned about taking antibiotics in our own body. So, I mean, it's not a holistic statement, but it is. It's a realistic and reasonable statement. So you come to my practice and Randy, you have a knee or a heart valve issue. I'm going to say, is it with regurgitation or without? What are you going to tell me?
I don't know. What's regurgitation? Birds do that to they're feeding their young.
Regurgitation means the blood's going backwards. It should be going the one way, but it's going back. You can't have that. It's bad.
Hey, can I ask you? So, how would you even know I had this? Do you take like almost a full medical thing when somebody becomes a patient?
You fill out, I don't know how many, like 40 questions.
Well, that's probably good for folks to know why they have to do this kind of stuff to go see a dentist, and there's a perfectly good reason for it.
So, usually we have a chance to sit down and talk to our new patients that come in, and then we have what's called a status exam every year. So say Randy and I were had a doctor-patient relationship for 20 years, but most of the time we talk about golf or fishing, or you like to eat food.
Popcorn. I'm a popcorn guy.
And you cook or whatever you do, and how you doing at Verdium with the interviews and stuff. And then it's been 5 years, and I haven't even asked how your health is.
Yeah.
Because I don't see them every day. If I saw them every day, I would know that, oh, you were sick last week. Yeah. Oh, you had COVID. Yeah. Oh, what happened to your knee? But that doesn't happen in real life, and we get distracted because we're human beings. And I think getting back to every year we do a status exam, we look at the medical history, we talk about it, and then just from that we can glean like, oh, that doesn't sound right, Randy. You know what? I need the number of either your physician's assistant, nurse practitioner, or the doctor that you have been seen by. And I want to see if they've optimized your health, because it looks like you changed your medication. This isn't making sense to me. It looks like you have we have a program, an app on our phone that cross interactions with different types of medications, because that can create a problem if we're doing surgeries or treatments for you. I mean, there's a lot to it. Maybe you came off chemo.
Yeah.
Does your doctor always want you to be on an antibiotic during this period for how many months after you complete and get the let's look for the remission? So it is important. We need to we need to know.
Well, again, I mean, talking during these videos, and if you watch a few more of them, I mean, it is more and more have this appreciation of speaking to you about the dental care is part of your whole care. I mean, it sounds like the old cliche thing, but really, you need to know what's going on down here or here or here. Both ways in terms of the health of the teeth and to make sure the health of the body is going to be good.
I totally agree. And to be very clear, I am not a physician. I'm not an MD.
We'll put that. This is not a real. This is only an actor. But the doctor part for dental, that is the real.
So I handle it right here, and then I ask the doctor if they've optimized your health with the management program and the medications, and if they are able to say yes, then I make my decision based on what I do. But I would never, ever say, don't take an antibiotic if your physician said take the antibiotic.
Good.
But I will give you the education on what you should be asking your doctor in not an awkward or like basically blaming them for not telling you about it. It's been that way forever. So just to finish with this, there was a study. They had a group of orthopedics in a convention. They gave them a survey after they had the information given that I just, zhushed up and threw it out there at you. 100% of them checked the box and said, yes, those patients that are without episode and had no problems, they're no longer requiring them to take antibiotics prior to dental treatment.
Simple.
Well, they went back 3 months later. 50% were still giving antibiotics. 1 year later, 75% are still giving. Close to those numbers.
Oh boy. Wow.
So that's why it's important to spend a little time on. We're trying not to give you antibiotics. If you need them, you need them. But certainly, if I could take one less tablet, I would be all about that.
Yeah, I think we're all about that too. And if you're about that, these are the kind of guys here who just want to do what's right all the time. And so take care of your teeth, take care of your health, Look at more of these videos at bilskidental.com and learn some more things. And we always have a lot of fun doing this, and there's always great things to learn. So thanks again, Dr. Bilski. Appreciate it.
Great to be here. Thanks for having me. Love it.